Thank you very much. This is actually an initiative that started about a little bit over 10 years ago, actually. And it's actually, as you mentioned, it is the Beginning Investigators Grant for Catalytic Research, and we call it BCAT for short. It's actually the premier initiative of the AORTIC, which is the African Organization for Research and Training in Cancer. And the idea is to develop a funding opportunity that allows for beginning investigators, early career investigators, as some call it in the United States, for example, to access funds that will empower them to have this catalytic experience in their research. So what we've seen in AORTIC is that you see these young folks graduate from PhD, and they sort of get stalled in that they don't know what to do. They can't access the R grant, for example, from NCI. And so if you look at the United States, there's a K award that allows for that transition. So BCAT gives us that opportunity to provide that kind of support for African investigators. And it's a collaboration or sort of working together of various organizations, including the NCI Center for Global Health, including AACR, and a whole lot of industrial and academic partnership. So it's not just an AORTIC thing alone. You have a lot of organizations coming together. And what this grant provides is that it provides, actually, I would say $50,000 US for research, and $5,000 US for fund that provide that funding to attend meetings and conferences for a period of 2 years. And so these individuals or these early career investigators that are selected are provided this fund and allows them sort of to conduct, doesn't have to be extremely groundbreaking cancer research, but something that will contribute to the understanding of cancer in Africa. And so that is what BCAT is all about. I think the aim is actually could be deduced from the name itself. It's for advancing cancer research that are conducted on the continent of Africa. And so that's one primary aim. The research has to be done in Africa. The second aim has to do with, as I said earlier, to support cancer research for African investigators, particularly those that are at early stage. And that leads us to the third one, which is to build local capacity for cancer research in Africa. You look at a lot of research that are done, particularly in Africa, are done from people who are affiliated to institutions outside Africa, or those that we refer to as Friends of Africa. So what we want to do, we're using this platform of BCAT to also contribute to developing local capacity in Africa. So that's those are the aims of BCAT. So far, we've had about 3 cohorts of, grant of awardees. And so you look at the first cohort, we have 7 awardees. Second cohort, we have 6. And the third one, we had 6, making 19 in total. So these 19 investigators have now progressed to become, independent researchers on their own. They've gone ahead to secure top faculty positions. They've gone ahead to secure bigger grants, out of, that is helping the grants that are, supporting their continuous research. And so we are very much happy and excited that indeed BCAT is living up to its, bidding to its expectation, in that it has helped these 19 investigators to progress, and it has helped them to catalyze their research. And we're excited that some of these researches are presented in this special issue, because the main purpose of this special issue actually is to showcase the progress that some of these investigators have really made in their research. So in these special issues, we're presenting 4 papers that are, authored by BCAT awardees. And so one thing I must also let viewers know is that BCAT is not restricted to one particular area of cancer research. It cuts across the whole spectrum of cancer research. or or cancer control itself. And so you look at one of the there are 4 papers that are presented in this special issue. One, the first one is the age distribution of cervical cancer by HIV status in South African women. And so one important finding of this study is that it clearly shows that HIV infection is a major risk for cervical cancer, with women that are HIV positive presenting 10 years younger than HIV negative women. So another important finding that the authors are discussed in this work is that the disproportionate burden of the HIV positive cervical cancer among Black women, even in South Africa. So we clearly see that even in Africa, there exists racial disparity in burden and risk of some particular cancer. And this paper presents for us a clear evidence for the status of disparity in cervical cancer presentation in South Africa. Well, I think that's a very important finding for us to know, because we've seen data from the United States, and it's good that we now begin to see data coming from Africa to complement what has been reported in other parts of the world. Another paper that is presented focuses on the symptoms, prevalence, and burden and the risk of depression among patients with advanced cancer. We know that cancer, why it's primarily, we know it's a malignant disease, but what data has shown is that patients with individuals with cancer and indeed cancer survivors tend to have higher level of mental health challenges compared to general population. And in this data presented here, looking at South Africa population again, show that 19% of cancer survivors present with or at risk of mild depression, and that's way higher than what you have in general population. And that leads us to the third paper, which focuses on fear, faith, and finances, health literacy experience of English-speaking and Swahili-speaking women, presenting with breast and cervical cancer, in Kenya. And clearly, the theme of this paper focused on that title, which is the fear, the concern, the agony that cancer patients go through in Africa, looking at Kenya, for example, and also how they survive with their faith, religious beliefs and things like that, how that help them to cope, and how the social support that they have, the social structure that we have in Africa, also help to lessen the burden of financial toxicity as well with cancer experience of this patient. And lastly, there's a basic science paper that looked at the association between gastric cancer and plasma selenium in Zambian adults, which is a case control study. We know that selenium is a major antioxidant matter, for that matter, and that there have been studies that suggested that things like that have antioxidant property may contribute to reducing the risk of some kind of cancer. But this data that is presented by Dr. Kayamba clearly shows that selenium, particularly the level of selenium in plasma, does not have any significant association with the risk of gastric cancer in the Zambian population. So we're excited about these 4 studies. This is just to showcase some of the landmark, progress that BCAT cohorts, awardees, have achieved. And we hope that, the readers and the viewers, we enjoy reading through these studies. We look forward to, for positive feedback that we can use to, move forward, the whole BCAT initiative as a whole. We're now in what we call the BCAT 2.0. The LOI, we've requested for the LOI. Quite a number of African early investigators have responded. We are now reviewing the LOI responses that we received from them, and hopefully sometimes in the middle of next year, we will be rolling out another award, to move to support African investigators.